Hello, 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 everyone. Welcome to Real Talk on Rona. Thank you so much for joining us again on this beautiful afternoon. We are so delighted to have Dr. Ryder here in the Real Talk on Rona studio with us today, which is being brought to you by the City of Tampa, Tampa Family Health Centers, the Florida Department of Health, and Hillsborough County. I am your host today, Janelle McGregor, and I am joined by my wonderful co-host, Melissa Marita, the Marketing Director for Tampa Family Health Centers. She is going to introduce our guest speaker today, Dr. Monica Ryder, who will be giving us the real talk on what individuals with asthma, diabetes, and cholesterol disorders need to do during the coronavirus pandemic. Hey, Melissa, how are you today?
Hi, Janelle. Doing well. How are you?
Doing well. Thank you again for joining us today.
Of course. I know we gave a little introduction about Dr. Ryder last week, but I wanted to do a little recap. Dr. Monica Ryder was born in rural northeast Arkansas at an early age. She recognized the limited availability of medical services in the area, and by the age of 6, she decided to become a physician. Dr. Ryder is a Xavier University of Louisiana graduate and went on to receive her master's in public health with a concentration in maternal and child health from the University of Alabama, Birmingham. With an unwavering determination to practice community medicine based on her childhood and educational experiences, Dr. Ryder went on to medical school at Nova Southeastern University College of Osteopathic Medicine in Fort Lauderdale, Florida. She completed her residency in family medicine at a community hospital in South Miami, where she was able to meet, treat, and educate patients of various socioeconomic status, advancing her goal of becoming a family physician to those with limited access to care. Upon completion of residency, Dr. Ryder immediately went to work in community medicine at Tampa Family Health Centers as a primary care physician. Since her tenure with Tampa Family Health Centers, Dr. Ryder has served as the interim chief medical officer, the adult medical director, and in her current role as a chief medical officer for the organization. Today, she works tirelessly to advance the quality of care that is provided to a population greatly in need of services. As you heard Dr. Ryder speak last week on the impacts of COVID-19 and how you may be at risk today, Dr. Ryder will be explaining why the safer at home order has been significant for those with underlying medical conditions during these unprecedented times, and why those with chronic conditions have been highlighted during this order, and why staying safe and maintaining social distance is so important. I am pleased to introduce Tampa Family Health Center's Chief Medical Officer, Dr. Monica Ryder. Dr. Ryder?
Good afternoon, everyone. I first want to again thank the City of Tampa and the Florida Department of Health and Hillsborough County for allowing Tampa Family to even be a part of the conversation. We're just so excited that we were allowed to share our bit of knowledge with the community and just kind of break some things down and calm some fears. So first things first, I just kind of want to give an overview. Myself and Dr. Ashley McPhee, the Director of Pediatrics here at Tampa Family, talked about this last week, but I just kind of want to give an overview again of what exactly COVID and the coronavirus actually is. So the coronavirus is a family of viruses which can cause illnesses in both humans and animals, as now we're seeing it being found in some cats recently. But several of the coronaviruses can cause mild symptoms like what you see in a cold, a cough, a sniffle, a low-grade fever. But it can be as mild as that or extremely severe as what we see in severe acute respiratory syndrome, which usually leads to a hospitalization. The common signs and symptoms of coronavirus are, again, the dry cough that will unfortunately go over to a productive cough, a fever, fatigue, and unfortunately, again, the very, very severe disease. It can develop into a significant pneumonia that would require hospitalization. How do we treat it? Technically, as of today, there is no true FDA-cleared treatment for COVID-19. We just really, really encourage patients to engage in supportive care. That is a lot of rest, a lot of fluids, healthy foods, and just kind of staying away from anybody who you might think is sick. How do we prevent the spread? Stay at home. That's the biggest way in which we can prevent the spread. If you do have to go out, of course, we encourage you to engage in social distancing, but the main way that's been proven to prevent the spread of the infection is with social distancing and staying at home. So I was asked today to talk about chronic conditions and how they are unfortunately adversely affected by COVID-19. And we just chose some main ones that unfortunately do have a negative effect on the community and the population that we see here at Tampa Family. And the ones that kind of rise to the top are hypertension or high blood pressure, heart disease, diabetes, asthma, COPD, and of course, as Janelle mentioned, high cholesterol or hyperlipidemia. So the first one that we're going to talk about is, let's see here. Hypertension, I think is the name. Okay, keep going. So heart disease is actually first. So heart disease in COVID. Well, first let's define what heart disease actually is. Heart disease is a cluster of conditions that can affect the blood vessels or the structure of the heart, and by structure we mean the walls, the ventricle, the valve, the tissue, but it also has an effect that can cause, or heart disease also includes conditions that increase your risk of blood clots. 40% of hospitalized patients with COVID-19 had some form of cardiovascular disease or cerebrovascular disease. That's for, in layman's terms, stroke. The heart already has to work hard when you have these types of heart conditions, but the arteries are even more compromised with the fatty buildup, and the COVID-19 actually does make it worse. So we have to remember the heart and lungs work together to spread oxygen around the body. And what happens is, if the body is sending the signal of, hey, we need more oxygen in the muscles, or we need more oxygen for the lungs, the heart rate might increase. Patients might get dizzy, you can get weak, and unfortunately you might even pass out. That low oxygen level is, yes, due to the lungs not being able to be oxygenated well enough, but also, again, the two systems work together. So if the heart's not pumping right, enough oxygenated blood is not getting into the body, the lungs start working a lot faster, and you unfortunately start breathing faster, you're feeling short of breath, and again, you get the dizziness, you get weak, and possibly, again, pass out. We know that the virus's main target is the lung, but the heart takes on so much work and tries to compensate for the lungs working so hard that it actually is taxing on the system, which can actually lead to fatigue and wearing out, for lack of better words, of the heart can actually lead to a heart attack. And that's what people kind of miss, unfortunately. We're so focused with COVID being a respiratory illness that it actually does do a lot of damage to the heart. Evidence has indicated that viral illnesses can, what we call, destabilize the plaques that are lining in the arteries. So sometimes if you do have high cholesterol, you have little fatty buildup along the vessel walls. When the heart rate is increasing or when the blood pressure is getting higher, sometimes those little plaques can dislodge from the sides of the arteries and move through the vascular system, through the arteries and through the veins. Sometimes, if you're lucky, those plaques will just move on through the system and they won't have any problems. But unfortunately, there are those occasions where the plaques can get, what we, just for layman's terms, can get stuck and cause a blockage. That blockage, too, can lead to a stroke. That can lead to also a heart attack. So, yes, you're thinking about the respiratory effects, again, of COVID on the respiratory effects of COVID, but you also have to remember that simple effect of you having heart disease or having high cholesterol. The plaques have already built up in your system. You're increasing your heart rate, increasing your pulse, can dislodge a plaque and actually cause a stroke or heart attack. And one of the newer findings is what we call microemboli. So some colleagues in the community are seeing patients show up with discoloration of their fingertips or discoloration of their toes, and not thinking again about COVID actually causing that? Because again, we're focused on COVID being the respiratory system. Well, some plaques dislodged and unfortunately affected the blood flow to the tips of the fingers, to the toes, and it unfortunately can sometimes be caught too late. So again, these are some of the effects that COVID can have on people with chronic heart conditions, including high cholesterol. Next is the lungs. So lung diseases when it comes to COVID. So one of the top ones that we'll focus on, because lung disease is a very broad topic, but the main ones that we'll focus on today are things like COPD or chronic obstructive pulmonary disease, asthma, emphysema, and unfortunately cancer. So with COPD, to just generalize it, that's just an obstructive disorder. That means that the airflow is not getting through to the air passageways as well as it could. Asthma is characterized by spasms in the airway, and it's usually triggered by some type of allergic reaction or a hypersensitivity to something that would cause an allergic reaction in a patient. Emphysema, unfortunately, is most likely due to patients that smoked and caused some irreversible damage to their lung. So you already have this a pre-existing condition with COPD, with asthma, with emphysema. So you're already struggling to breathe. So imagine having COVID. Imagine having this very new virus that is increasing inflammation in the lungs, and it is causing a new infection to settle into the lungs. When you have COPD, asthma, or some other type of lung infection, you're unfortunately kind of used to not breathing well all the time. You're kind of used to grabbing your inhaler every so often when you're dealing with any shortness of breath. If you go outside and it's pollen season and it's a little bit of it causes a reactive airway syndrome in you, so you just grab your inhaler and you think nothing of it. Well, that inflammation may not be responsive to your normal medications in the event you do have COVID. It can take you 5 to 10 days to really start seeing the symptoms of an infection like COVID-19. This infection, on top of the difficulty that you already have with breathing, actually makes the restriction in the airways worse. We are strongly advising patients when you have COPD or asthma and you are not getting relief of your symptoms with your inhaler as you normally would, you need to immediately call your provider, call your primary care provider or your specialist. We are not asking you to come into the office right away, but we are asking you to call in and let them know. Say, hey, normally when I step outside and I am exposed to the pollen, I can take a couple of puffs on my inhaler and I feel fine. But this time it's taken me 3 to 4 trials with my inhaler and I'm still not feeling well. What should I do? Your primary care provider or your pulmonologist will give you guidance, but typically that means you are not dealing well with an infection as you normally would, and you might need to be seen. We're advising these patients to not actually come into their outpatient setting. We do want you to be seen in the hospital because, heaven forbid, as you see on the list, there is the risk for respiratory failure. And a lot of outpatient centers cannot deal with the symptoms if you are severe. If you come to like your primary care office, we are more equipped in the hospital setting. We have respiratory techs. We can provide respiratory therapy for you. But in the outpatient setting, that's not very typical. Let's see, what else can we talk about with respiratory conditions? Those are the highlights, quite honestly. Just know that the coronavirus, it is a virus, but because of having COPD or asthma or emphysema or any other respiratory condition, it actually unfortunately leads to worse symptoms and unfortunately a worse outcome if you do not address the infection sooner rather than later. Diabetes. So unfortunately in our community, we do have an increased number of patients with diabetes. So just in general terms, diabetes is a group of conditions during which the glucose or the sugars in the body are not well controlled. And I say a group because people just assume there's just one type of diabetes. You got diabetes, and that's the end of it. Well, that's not the case. There's technically a type 1, type 2, and even pre-diabetes, okay? So unfortunately, when it comes to diabetic patients, what has been shown so far in the literature, and please understand, COVID-19 is new, so we're still collecting data. But so far, we already see that the patients that have diabetes, and when their diabetes is not well controlled, those are the patients that are not doing well with the infection. So does it mean that if you have diabetes and you unfortunately contract the COVID-19 virus that you're just automatically going to get really, really sick? No, that does not. We, again, stress it's the poorly controlled diabetics that unfortunately have poor outcomes with COVID-19. But there is a correlation there. So when we see patients that do have poorly controlled diabetes, unfortunately, we also see that they either have high blood pressure, or they have high cholesterol, or they have heart disease. So it's the combination of all those complications that actually can increase your risk for worse symptoms. We strongly, strongly encourage those patients that have diabetes and they know that it's poorly controlled, meaning their hemoglobin A1C is above 8 or you're on some type of insulin, that you're carefully monitoring your sugars and staying in close contact with your primary care provider and letting them know when your sugars get above 240 2 times in a row. And I say 240 specifically when you believe you are monitoring your diet very well, you don't feel like you've eaten anything that's not on your pre-diabetic or your diabetic diet plan, you're drinking plenty of fluids, and you're exercising appropriately. If you are engaging in all of the activities that you're supposed to and taking all your medications as prescribed, but yet your sugars do not come below 240 on two consecutive checks, you need to call your primary care provider or your specialist, which would be an endocrinologist, and let them know. Type 1 diabetics, we know that your sugars can be quite brittle. And unfortunately, when you are exposed to any infection, regardless of it being COVID-19 or any type of bacterial or viral infection, your sugars can kind of go off the charts or they will plummet. It's very, very, very important that you pay close attention to your sugars, but you all also have to monitor your electrolyte levels. Again, please, please call your primary care provider or your specialist if your sugars remain above 240 or drop below 60 on a regular basis, because you do need to be seen by a provider quickly. Some serious signs and symptoms that we look for in diabetics when they do unfortunately get ill with any type of infection, but in this case COVID, is confusion. We know that that's a sign that sugars are poorly controlled when diabetics start to experience a new onset of confusion. And that's not, oh, I forgot my keys, or I can't remember where I placed that piece of paper. This is when you are really not knowing who you are, where you are, or the people around you. Serious confusion is a significant sign of a poorly controlled diabetic and a poorly controlled response to an infection. Shortness of breath, weakness, numbness, and tingling are also signs that you are not, that you might have an infection and that it's poorly controlled and that you might need to be seen by a provider sooner rather than later. Autoimmune disorders and COVID-19. By nature, patients with autoimmune disorders, and that can include, definitely not limited to, but it can include lupus, autoimmune arthritis conditions like rheumatoid arthritis, or psoriatic arthritis, inflammatory bowel disease like Crohn's, type 1 diabetic, that's actually an autoimmune disorder, celiac disease, the list goes on and on. But patients with autoimmune disorders, sometimes they're inherently at risk for worse outcomes with viral infections and bacterial infections. It is imperative that you all take your medications as prescribed. There is still research being done on the effects of COVID-19 in autoimmune disorder patients. but we know already that significant fatigue will hit our autoimmune patients rather quickly. They get achy muscles, but one of the differences in patients with autoimmune disorders and those without is a low-grade fever. Your body doesn't react to certain illnesses as somebody who does not have autoimmune disorders. So we don't want you to wait until you get a temperature of 102.7. When you start seeing that your temperature is going up, what we would classify in the medical world as maybe a low-grade fever is something of significance to someone with an autoimmune disorder. So if you start feeling symptoms and that your prescribed medications are not helping your typical autoimmune disorder symptoms, and you're getting this low-grade fever or you're starting to feel weak, you need to call your provider right away. Again, we ask that you in particular not run to the office. We want to do everything that we possibly can to decrease your exposure to contracting the virus. So please call ahead and allow your primary care provider to give you guidance as to what your next steps should be. So what can you do if you have one, two, or all of those chronic conditions that we talked about? All of the associations, and that's the American Heart Association, the American Diabetes Association, the American Autoimmune Disorders Association, we're all on the same page. Take your medications as prescribed. Do not try to overdo it and try to, quote unquote, protect yourself by taking extra insulin, or do not try to hoard any of your medications because you're nervous about what might happen with the pharmaceutical organizations. Please take all medications as prescribed. This is one of the best ways to keep yourself healthy in such an uncertain time. Exercise, but exercise at your level of ability. Please do not go out and try to do anything extra as far as don't sign up for any P90X classes online. Do not try any new exercise crazes. Stay within your level of ability, but keep yourself active. I know that respiratory therapists will agree that one of the best ways to keep the lungs nice and healthy and open is just taking nice, simple walks. It encourages the heart rate to raise a little bit, but it also encourages the lungs to fully inflate, and it's exercising the muscle. A proper diet, of course, that's with anything, having chronic conditions or not. We encourage a proper diets full of leafy green vegetables, fruits, and whole grains. And again, that's patients with or without chronic disease. You can take supplements if necessary, if for whatever reason you're not able to get to the freshest greens right away. We understand. We do want you to kind of veer away from places like the grocery stores because they can be there are places in which you can expose yourself to infection, but at the very least, we do want you to engage in a healthy diet, but supplement as needed. Hygiene. The biggest thing with the hygiene is washing your hands. Wash your hands. And if you're not able to wash your hands, of course, use products like hand sanitizer. But after every 3 times of using hand sanitizer, please go wash your hands with soap and water. You're not doing yourself any favors by piling on hand sanitizer. And sleep. The body does its best recuperation when you're just getting a good night's rest. That's 6 to 8 hours. Everybody is different, of course, but we do encourage 6 to 8 hours of sleep. And I wanted to talk a little bit about some of the myths. Of course, we're all seeing, unfortunately, the Clorox and the quote-unquote treatment of Clorox or ingesting any type of cleaning detergents. Please, please, please do not do that. Please read the labels on any of these products, and one of the first things they say is to not ingest. There is no science behind ingesting any types of products such as these, and it's just it's uncalled for. The little spot in the middle is talking about coronavirus. Before it reaches the lungs, it remains in the throat for 4 days, and at this time, the person begins to cough and have throat pains. If he drinks water a lot and gargles with warm water and salt or vinegar, it can eliminate the virus. That, unfortunately, is a huge myth. How I would wish it were true, because we could get rid of a lot of viruses in that way, but unfortunately, there is no truth to that. There is truth to maybe using some warm saltwater gargles to assist with symptoms if you're having some post-nasal drip from some allergy symptoms. And of course, go ahead and gargle, but please do not use that as a way or means to quote unquote treat coronavirus. 5G, let's all just dispel the myth, please, that the 5G towers cause COVID. There is absolutely positively no proof. There is no evidence to that myth, and I'm not quite sure honestly where it even started. But go ahead and let's stop spreading that one. And one of my favorites was a blow dryer to the nostrils and to the throat, and that there was the belief that if you breathe in hot air, it could actually kill the virus. Again, there has been no evidence to that. Please do not do that. Drying out the mucous membranes actually is counterintuitive. We have healthy bacteria that actually live within our mucosa that is keeping you from getting sick from other agents. So please, please, please do not use a dryer for your nose or for your mouth. Again, if you take home nothing from this little webinar, one of the most important things that I can stress to people when you have chronic conditions is you must stay in contact with your primary care provider. Here at Tampa Family, we still have all 15 centers open. We are still providing primary care services to all of our patients, to those that are sick, to those that do have chronic conditions like diabetes or lung conditions, or they have cancer or autoimmune disorders. We are encouraging them to utilize our telehealth services. Please find out from your provider if they have telehealth services. That's an easy way for you to still talk with a doctor or a nurse practitioner or a PA or a nurse to discuss any kind of symptoms or concerns that you might have about your condition or about COVID. It is a great way to get just your medications refilled if necessary until the clinics are open full. That is exactly what we are doing. We are not encouraging any of our patients who do not feel well to come into the building. We are allowing them to call in. They can talk to us. We will refill their meds. We are even providing drive-up services with our pharmacy and taking the medications out to their car so that they don't have to come into the building. Please contact your primary care provider to see if they have those services available to you. As a patient with chronic conditions, we are not saying that you are at a greater risk of getting COVID. You are at a greater risk of getting worse symptoms with COVID. So please, we encourage you, please take care. Take your medication, stay in contact with your primary care provider, and just follow their guidance. So with that, we would like to open it up to anybody with any questions or concerns that you might have about COVID.
Thank you so much, Dr. Ryder, for again taking the time to educate us on those chronic conditions and what it means when you have a chronic condition and now you're living in these challenging times with coronavirus. We do have a couple questions that came in. Our first question is a two-parter. It says, do allergies count as a chronic condition? And if I have seasonal allergies, should I be worried about COVID-19?
Okay, so that is a great question. I unfortunately could not list every single chronic condition that's out there, but yes, technically, allergies, it is a chronic condition, and if you live in certain parts of Florida, you know too well that allergies and seasonal allergies may be called seasonal in title, but it is chronic. It's something that's coming around every year and multiple times a year, and you do have to treat it with medications on a regular basis. We all should be worried about contracting the virus. What I stress to my patients that do have allergy symptoms or chronic conditions like allergies or seasonal allergies, continue to take your medications as prescribed, but understand your body's response. Understand that when you come into contact with pollen or whatever your allergic reaction may be, understand what you would normally feel like, and if it seems to veer away from your normal, that's when you need to call your primary. So if I go outside and I have severe issues with dogwood trees, my reaction might be just a little watery eye and then nothing major. But if I'm going outside and I run to my favorite grocery store, and then, I got to stop at the gas station, and then I just decide to stop off at my church because they're still, for whatever reason, engaging in some activity. And then 2 to 3 days later, I'm noticing that I'm going outside and I'm having watery eyes. Now I'm getting short of breath and I'm coughing. I can't say that that's allergies. I might have been exposed to someone with the virus. So you have to understand what your initial reaction is to your seasonal allergies and monitor yourself and see when your symptoms might change or if your normal reaction is worsening. That's when you do need to call your primary care provider. But again, take your medications as normal. You're not at a greater risk for contracting the virus. Your symptoms might present differently, or your allergy symptoms might present worse if you have been exposed to the virus.
All right, thank you so much. We have another listener who wants to know if they're having trouble breathing. Let me rephrase that. We have another listener who conveyed that they're having trouble breathing, but they're also scared to wear a mask. What would you recommend they do to protect themselves from COVID-19?
Okay, so that is a good question because it's actually listed as one of the contraindications to wearing a mask. If you have difficulty breathing, we don't want you wearing a mask. That can increase your anxiety. That can actually make you breathe at a faster rate. And again, like those symptoms I mentioned before, make you dizzy, pass out, weak. So technically, if you have trouble breathing, number one, you should reach out to your primary care provider because we don't want anybody sitting at home and experiencing difficulty breathing. You really should reach out to somebody. If you have a history of using your inhaler, and of course it depends on your primary care and what regimen you all have established, but say you're supposed to use your inhaler 2 to 3 times a day, but you're actually reaching for yours 6 times a day, that is a problem. You need to call your primary care provider because you actually might need to go in either to see your specialist or to the hospital for further evaluation. The mask can actually make you, again, increase your anxiety and make the breathing worse. And we understand that. It makes you feel like you're suffocating. So we don't want anybody who's already having that symptom of shortness of breath to slap a mask on their face and make it worse. So again, if you find yourself in that state, reach out to your primary provider immediately and find out next steps.
All right, thank you. Another viewer says, I want to talk to my doctor, but because I have underlying medical conditions, I don't want to go to the center. What are my options?
I would, if they're not having the telehealth, because that's really one of the main clinics or the main options that most health centers are going to, that we really don't want you to come into the offices because, again, we don't want to in any way have you leave your home and unfortunately expose yourself. The best way for you to get in touch with your doctor is through telehealth. Find out if you can reach your providers through portals. Nowadays, a lot of organizations such as Tampa Family Health Centers utilize portals to talk with our patients. So I would find out if you can have a discussion. It may not be with the doctor or the nurse practitioner or the PA, but it could be with a nurse who's on the other end of that portal who can answer some of your questions, comments, or concerns.
All right. And our last question of the day comes from another viewer who would like to know what kids with chronic lung disease should do when they return to school next year.
So my advice to any child that has a chronic condition is to not change your current, the current plan of action. So technically, Most children, if they do have a diagnosis of a chronic condition and if they are on some form of medication, they should have been having that conversation with the primary care provider, be it pediatrician or not, and had a document that they can provide to the school that states this child needs to take this particular medication at this time of day. You will not, at this moment, need to change anything else. Of course, we don't know what school is going to look like come fall of 2020. We all, as a parent myself, we're all hoping that school will start back in August, but nothing is guaranteed at this moment. But technically, nothing should change. You definitely need to start having the conversation with the primary care provider, have the documentation in place with the school, have any medications that the child might need on hand at the school with the school nurse.
Well, we want to thank you again, Dr. Ryder, for taking the time out to educate us about what we can do to stay safe and healthy during the coronavirus pandemic, the information you shared about the need for exercising and having a proper diet, just thinking about all the different creative ways gyms and even the cooking channel are using to promote those healthy habits. You can even go on online and do your home workouts right at the house through some of our local gyms. So I thought that was great. And the information on the myths, everyone, please, I hope that you paid attention to those myths. If you have any symptoms, get tested. Don't ingest Clorox. The information that Dr. Ryder shared is invaluable, and we all definitely need to take it to heart, folks. Okay, so how many of you all know someone, or maybe it's even yourself, who has been experiencing COVID-19 symptoms, but you haven't gotten tested yet? Please go get tested. Hillsborough County has 2 drive-through testing locations, one at Raymond James Stadium and another site at Lee Davis Community Center. You don't need insurance. The test is free. All you need to do is call 813-272-5900 to make an appointment. We cannot stress enough the importance of getting tested if you are experiencing any of those symptoms. Don't worry about if you have insurance. Don't worry about having money. Please just go get tested. We will get through this together, everyone. Thank you again for joining us today. Don't forget to tune in on next Wednesday. We have another Tampa Healthcare Center professional, Ms. Reed, who's going to be talking to us about this health crisis's impact on our mental health. So we definitely want to tune in this Wednesday, April 29th at 12 p.m. Thank you again, Dr. Ryder and the Tampa Family Health Center staff, along with our partners at the Florida Department of Health and Hillsborough County government, for helping to make Real Talk on Rona possible. Stay calm, stay safe, stay informed, and we'll see you next time.